Now, if I were to need bone grafting, where does that bone come from, and how do you do that?
Well, that depends upon, again, the patient's individual situation. Our goal is to get everything set up for them so that they're going to have the best long-term result, most comfortable, most cosmetic, most functional. And sometimes we don't have enough bone to do what we want to do, say to place a large enough implant or to place an implant in exactly the right place. And this time we need to build up the bone a little bit in that area to fatten it up somewhat. Depending upon what kind of grafting we have to do, this can be pretty simple or a somewhat more cumbersome experience. But no matter what, we keep our patients comfortable throughout their post-operative course and make sure that they're getting along as well as they possibly can. And we rarely have any patients who have significant trouble after their implants are placed. And it still makes this a very reasonable approach to managing their problem originally.
Oh, that definitely sounds great, because it sounds like a lot of the worries are taken away, because it doesn't take as long as you'd think, and it doesn't sound like it's too uncomfortable. So it really does sound like a good way to replace a missing tooth.
I think it's the best way in almost every case.
If I was going to be having an implant placed, how long does that take? Because I'm kind of nervous about sitting in the dentist's chair.
Well, we all are. I understand that completely. And we'll do anything we can, again, to make our patients feel comfortable and help them get through these procedures so that their results are something that makes them happy for the rest of their lives. Sometimes when we do a dental extraction for a person, we can immediately put a little graft material into the site where the tooth was, and this does a lot of good for us. It gives us a much better option at the end of the grafting process for the placement of the implant in the right place. Sometimes we need to do things that are a little more extensive, and these would include grafting where we have to thicken up the area that we're going to be working in, or where we need to strengthen the area where we want to put the implant in. These grafting procedures are done in the office. They're almost always done under sedation. Our patients find that they're with us for an hour to an hour and a half that day, and then they take a day off because of the sedation. And usually they'll take another day or two after that to really recover and get back into eating their normal foods and doing their normal activities. The range of options that are available to us in terms of the different kinds of grafting or the different kinds of grafting material have been exploding exponentially. So patients who have a concern about a particular issue can always be helped. And using the high-tech approach that we do, where we use growth factors, for instance, from the patient's own blood, or different kinds of materials, including lab-grown proteins and other really high-tech things, have been very important to us and impacted the way we approach our patients, completely changed many things over the last 15 or 20 years.
From what I've heard, that when a tooth comes out, usually it's recommended to place a bone graft at that time. Why is it necessary sometimes to have a bone graft later on, like a second bone graft?
Well, again, the implant needs to be placed in exactly the right place. It's got to be in exactly the right orientation so that the forces that are put onto the bone when a patient bites on the tooth and transfers the force to the implant and transfers the force to the bone is kind to the bone, so that the bone will continue to live comfortably after the implant and the restoration have been placed. If we ignore that need and just place the implant where the bone is and let the dentist restore the tooth, we're bound for a less than optimal result. So that may work in some cases, but when it doesn't, we want to be sure that the patient is going to get the best possible outcome and the best possible preparation.